Berberine and weight loss.
Well, berberine, of course, like the latest craze, is not the whole story, folks. There are many other nutrients that need and should be included to make it more effective.
And so berberine is in the news, and they're discussing berberine like it's the next, or it's the natural Ozempic. What are your thoughts? And there's a lot of other, berberine's been in the news for other things, but what are your thoughts specifically on berberine being called the natural Ozempic? Do you think that's a little reckless, or do you think it's warranted?
Well, I think it's probably at least in part accurate. However, it places berberine, which is a natural herbal extract, in the same potential class of misuse as Ozempic.
Oh, yeah.
Keep in mind that Ozempic and its relatives is really designed for hypoglycemia, insulin resistance, and type 2 diabetes.
And the main one, type 2 diabetes.
And mainly type 2 diabetes. Yeah. Because of its ability to regulate insulin production.
Yeah.
And when we start using these things for purposes other than they were intended, there can be issues. And as we are now discovering, the issues connected with things like Ozempic and probably eventually berberine can be significant. Significant gastrointestinal distress, which oftentimes persists after the person stops taking these things. And what the manufacturers of these drugs don't tell you is that in order to maintain the benefit of weight loss, you have to take it indefinitely.
Yeah.
And that can present a problem with people with normal insulin levels because it's driving your insulin levels too low.
What is the other benefits and risks associated with natural berberine?
Well, again, everything is dose specific. If you take 2 aspirin for a headache, you're good. You take 12 aspirin for a headache, you may not be so happy. And so everything is dose specific. And it's the same with herbal extracts. Berberine is a natural herbal extract. If a little's good, very rarely more will be better. And berberine is very difficult on the digestive system for many people. And I always suggest that when you choose to use it, then I would recommend starting out with a very low dose, taking it with a meal to help prevent gastrointestinal disturbance. But you see, people, especially people who are doing things to lose weight, there is no greater class of desperate human beings on earth than people who want to lose weight.
Yeah.
But they want it now. The fact that they've been overweight for 20 years doesn't concern them. Now, they want it tomorrow. Yeah. They want to be trim and their ideal weight tomorrow.
And they want to do it in a week.
Yeah, and that doesn't happen, folks. It doesn't even happen in a few months most of the time.
Yeah.
But what happens
it took me 9 months to lose 60 pounds.
But you did it right.
Yeah.
And as a consequence, you never gained it back.
No, yeah.
Now, you're still at the same ideal weight you were years and years ago.
Yeah.
And that's the difference between doing it right and not doing it right. And one of the ways that you cannot do it right is to take these substances, including berberine, in excessively high doses and thinking that, wow, this is just going to peel this weight off of me. And it's true, it helps. But it helps by specifically addressing insulin levels. And if you're not diabetic or hypoglycemic, your insulin levels might be elevated, but they're probably not elevated excessively. And by taking high amounts of these things, including berberine, you may be driving your insulin levels too low. And you're putting your digestive system at risk at every level, stomach, intestines, colon. So if you choose to use this, I'd start out with 100 milligrams, not 500.
Yeah.
And that's what everybody said. Take 500 milligrams 3 times a day. Well, you may pay dearly for that, and you may not. It depends on your system.
Well, because everyone's different.
But why not start out with 100 or 200 milligrams once a day, see how your body tolerates it, and then add some more until you find a safe threshold. But just because something is natural versus drug doesn't make it 100% safe in all cases. You can OD on natural substances.
Yeah, well, I mean, you can OD on water.
Yeah, believe me, I've talked about that many times. Everybody's preaching about dehydration and lack of water, and it's true. A great many people do suffer from dehydration because they don't drink enough water or get enough fluids, not just water. But you can OD on water and so deplete your electrolytes that you go into cardiac arrest. So again, if a little's good, more is not necessarily better.
So let's say somebody doesn't want to do the Ozempic. They talk to their doctor. They go, the doctor, whatever they decide on. But they want to try to do the Berberine. What other, and they go to their doctor and they tell them, hey, I'm thinking about taking this supplement and it's called Berberine. What would a good direction of cofactors, what are the cofactors needed to help the absorption and efficiency of Berberine?
Well, trace minerals such as chromium, vanadium, the amino acid aspartic acid would be something I would put into a Berberine complex formula, because they not only are going to accelerate your response, but they're also going to help mitigate some of the potential side effects of elevated excessive Berberine consumption.
And so the only product that has Berberine in it from Phoenix Nutritionals at phoenixvitamins.com is the blood sugar support, and that's because of what it does and what it's for. So there is Berberine in the blood sugar support at
but a host of other things as well.
All the correct cofactors.
Which is going to help the body utilize Berberine better and get a better benefit from it without having to take excessively high amounts.
Yeah. Well, I think that's a good foundation for people who are thinking about talking to their doctor about Berberine, or even the more fear and dreaded one of Ozempic, But I think that educating people about the natural ways, I think, is always kind of a good thing. I mean, some of the headlines are a little bit much, I think. But I think a natural way to go is, in my mind, always better.
Well, of course it is. But I just want to leave this discussion with making you aware that just because something is all natural doesn't mean it cannot have potential side effects if abused. So it's always use and abuse, and everything is dose specific.
Yeah. Well, there you go. That's the natural scoop on Berberine.